sensation of turning or spinning, and frequently this is called, usually the cause is the inner ear. Okay? So, you have two types of vertigo. I'm sure you sometimes ask your patient, no? Kayo mo ba ang nahihilo o ang paligid nyo ang nahihilo? Okay? So, objective vertigo is known as objective when the patient perceives that the environment is moving. So, yung paligid niya ang nahihilo. Subjective, the patient feels himself moving in a static environment, which means yung pasyente ang parang umiikot. And usually, kapag objective, yung paligid ang umiikot, that is what we call vertigo. So it's more actually clinically important. Okay? So there are actually 4 types of dizziness, okay? But vertigo on the first column is known as vertigo because there is actually an illusion of movement, which is rotatory. The other symptoms are just your dizziness or imbalance. So you can have your presyncope, which is a feeling of fainting and loss of consciousness. A disequilibrium, patients may feel unsteady and feels that the head are affected and relieved when sitting down. So this can be caused sometimes by your medications when you have too much of your antihypertensive drugs. Okay? And other subtypes like swimming, floating, feeling of dissociation, and may be difficult to describe. And these things may be psychological in nephrology. I'm sure we have some psychiatrists here. And we're going to talk more of vertigo in this lecture. Okay? So maintaining balance is actually not a factor or a main concern only of the inner ear. Okay? The balance is actually also important when the eyes also has an input in terms of imbalance. The most common of imbalance in terms of the eye is the error of refraction. Okay? Skin pressure is also important, where you feel like you're falling and you hold on to something and your skin presses on a chair. Your skin pressure receptors are actually working, and you get to feel that you are actually have a balance. Okay? Your muscles and joints also have a factor. So, adults and elderly who have problems with their legs because of osteoarthritis can also have imbalance. And of course, in terms of the ENT, we talk more of an inner ear problem or the vestibular problem when you have actually vertigo or dizziness. And all of these are actually integrated. The ear, the eye, the skin pressures, the muscles are integrated in one system, which is your central nervous system. Okay? So when you're dealing with dizziness or vertigo, the most important thing you have to consider is the cause peripheral or central? Okay? Because you do not want to miss a central cause of vertigo. Okay? So all of these eventually are integrated into your central nervous system, okay? And that causes the importance or the balance of a patient. This is the inner ear, the vestibular system. If you try to recall your internship, okay, this is the inner ear. This is the cochlea is for hearing. The vestibular system consists of your semicircular canals and your vestibule, which is your cubicle and saccule. And within your vestibular system, you have your endolymph, which is important in terms of the fluid inside your inner ear. Okay? The left ear and the right ear should always have the same input to be able to balance, for the patient to balance. Okay? So within the inner ear, you have sensory hair cells that provide information on the position and movement of the head. Okay? So let's go to the epidemiology or prevalence of your vertigo. This is actually a study in 1998 and 2001 in the British Journal of General Practitioner. Vertigo in a population-based study is about 47% of patients, and usually vertigo accounts for almost 1/4 of those who present with dizziness. And of course, when you're aged more than 75, which is the elderly, 40% of women and 30% of men report some cases of postural disturbances. So there are actually more women complaining of dizziness. Okay. Do we have more women here or more men? More women, no? So I'm sure some of you have also experienced some form of dizziness. I personally have experienced dizziness, and it's really difficult, no, to work when you're dizzy. Okay? So vertiginous complaints account for approximately 50% of the patients that present to the ENT only. But I'm sure you as internists, no, usually get to see more of the patients who are vertiginous or have dizziness. Vertigo is not considered seriously enough. That's why sometimes this is not usually, when patients go to you, would say just give some of their medications. However, you find out that you have to be able to differentiate a peripheral versus a central cause of vertigo. So, as you can see, the number of patients presenting with dizziness to the primary care professionals increases with age. No? This is a survey in the United States among 2,879 physicians. So, ang mga doktor ang actually tinanong. Okay? So, even very young age, they have found out to have also dizziness. But it becomes more frequent now when the patients goes into midlife. Okay? And furthermore, when they become elderly, it increases the number of dizziness, patients complaining of dizziness. So it seems that age has a factor when in terms of complaints of dizziness. Okay. So the main thing we want to determine is it peripheral or central cause? The most common cause of peripheral causes, of course, is your inner ear. And central causes are usually caused by your cerebrum, cerebellum, or brainstem. So problems with the brain, okay? Or like hypertensity or anything, based on the vascular insufficiency. So let's go to some of the diseases in terms of peripheral causes. These are the different diseases, okay? But in terms of ENT practice, we will just consider 4 of the common diseases. Benign paroxysmal positional vertigo is about probably 75% of the causes of vertigo in our practice as well, I think, as in the practice of the internists. Okay?